Mary Collins had spent 43 years doing everything right. She never missed a mortgage payment. She raised 2 children. She retired with what she believed was enough. Then, one signature on what looked like an ordinary healthcare form almost erased everything she'd worked for. It wasn't a hacker. It wasn't someone breaking into her bank account. It wasn't even someone pretending to be her grandson. It was something far more believable, someone she thought was helping. And by the time she realized what she'd agreed to, thousands of dollars had already disappeared. If you're retired or planning to retire, this story may feel uncomfortably familiar, because the scariest scams rarely begin with someone asking for money. Sometimes they begin by offering help.
Mary was 72, a retired elementary school teacher in Ohio, widowed for 6 years. Her closest friend was Linda. Her son, David, lived nearly 800 miles away. Most days followed the same routine: morning coffee, a walk around the neighborhood, an afternoon crossword. Simple, peaceful, until Tuesday morning. The phone rang.
Hello, Mrs. Collins.
Yes.
My name is Rebecca. I'm calling because you've qualified for a new senior health support program.
Rebecca sounded calm, professional, never rushed. She already knew Mary's doctor, her age, even her Medicare plan. Mary relaxed. People don't usually question someone who already seems to know them. Rebecca explained there were new benefits available: free equipment, prescription savings, transportation assistance, home wellness monitoring.
It won't cost you anything today.
That sentence mattered, because today wasn't the same as never. Mary didn't notice the difference.
Rebecca called again and again, never asking for money, only checking in, asking about Mary's arthritis, her sleep, whether she'd been feeling lonely since losing her husband. No scam alarm, just kindness. That's what made it dangerous. Meanwhile, David noticed something different during their Sunday video call. His mother kept mentioning the healthcare coordinator. She smiled.
She's been wonderful.
David felt relieved. Someone was looking out for Mom, or so he believed. Then came the package: a thick envelope, professional branding, medical language, forms, brochures. Everything looked legitimate. One page simply said, "Please sign here to activate your enhanced services." Mary signed, without reading the fine print. 3 weeks later, Mary opened her bank statement. Nothing unusual, until she reached the second page. A charge: $289. She frowned. Probably a mistake. The next month, another charge, then another. Different company name, same amount. She called the number. Long hold. Then someone answered.
Mrs. Collins, these are authorized wellness membership services.
Membership? I never signed up.
According to our records, you did.
Silence. Mary remembered the forms. Her stomach tightened. David drove 8 hours the following weekend. He spread every paper across the dining room table: statements, brochures, contracts, receipts. That's when he found it. Page 17. Tiny print. Automatic monthly billing. Cancellation rules. Optional monitoring services. Equipment rental fees. Not illegal, just buried. Rebecca had never mentioned any of it. Mary whispered.
I thought they were helping me.
David wasn't angry. He was heartbroken, because his mother wasn't careless. She'd simply trusted someone who sounded trustworthy. The charges continued while David tried to cancel. Different departments. Transferred calls. long waits. Each representative sounded sympathetic. No one solved the problem. Linda suggested contacting the bank. The bank froze future payments, but recovering previous charges proved difficult. Some had technically been authorized. Months passed. Mary calculated the loss. Nearly $5,000. Money she'd set aside for dental care, home repairs, emergency savings. Gone. Not stolen in one dramatic moment. Slowly, quietly, almost invisibly.
David started researching. He discovered similar complaints, different names, different companies, same pattern. Friendly phone calls, healthcare language, complex paperwork, recurring charges. Most victims never reported it. Some blamed themselves. Others felt embarrassed. Mary almost did too, until David said something she'd never forget.
Mom, being kind isn't a weakness. Someone else's dishonesty is.
For the first time, Mary stopped blaming herself.
The family rebuilt their system. No signing documents alone. No agreeing to services during phone calls. Every healthcare offer waited 24 hours before any decision. Linda became Mary's second eyes. David received alerts for unusual withdrawals. It wasn't about fear, it was about slowing down, because urgency is one of the oldest tools in deception, and patience is one of the strongest defenses. Months later, Mary volunteered at her local senior center. She didn't lecture, she simply told her story. One afternoon, another widow raised her hand. "I received that exact phone call yesterday." The room fell silent. Mary smiled gently.
I'm glad you waited.
No applause, no dramatic music, just quiet understanding. Sometimes one conversation saves someone else's retirement.
Today, Mary still keeps that original healthcare packet, not because she enjoys remembering it, but because it reminds her that trust deserves time. She eventually recovered part of her money, not all of it, but she recovered something even more valuable, her confidence. She no longer assumes every friendly voice is a friend, and she no longer believes embarrassment should keep anyone silent. If this story reminded you of someone you love, or if you've ever received a phone call that simply didn't feel right, share your experience in the comments. You may help someone recognize a warning before it's too late. Because retirement shouldn't be defined by fear. It should be protected by knowledge, shared one story at a time.